Now let's discuss the next property, which is refractory period. Now imagine you stimulate a nerve and the nerve responds with an action potential. Now while this action potential is going on, you decide to apply a second stimulus. So the nerve again responds. And during this action potential, you now apply yet another stimulus and the nerve again responds. What would happen? The nerve would just become tired and its performance will reduce. This should not happen. In order to prevent this, we have something called refractory period. So refractory period is defined as that phase of the action potential during which, no matter what you do, the tissue will not respond to a second stimulus. So this is protective because it prevents fatigue. A nerve usually has a long refractory period, and that makes sure that it does not easily undergo fatigue. Now let's understand the refractory period using a graph. So this is a recording of the action potential obtained from a nerve. Now you can see that this is the threshold. So a stimulus has been applied. So you have an action potential. Now refractory period can be divided into two phases. This is your absolute refractory period. It extends from the threshold or the firing level to 1/3 of repolarization. Now why do you call this as absolute refractory period? Because in this phase, when you apply a second stimulus, no matter how strong it is, the tissue will not respond. It is absolute. On the other hand, this phase, that is from 1/3 of repolarization to the beginning of after depolarization, is called relative refractory period. And why relative? Because during this phase, if you apply a second stimulus which is stronger than the first one, the tissue responds. So overall, this is your refractory period. So if you assume the action potential duration to be about 2 milliseconds in this nerve, then the absolute refractory period is about 0.1 millisecond. The relative refractory period is about 1 millisecond. So that's a total of 1.1 milliseconds. So only the remaining 0.9 milliseconds is non-refractory. Let's now discuss the property that defines the nerve, that is conductivity. So conductivity is the ability of a nerve to transmit signals across long distances. Now conductivity differs between myelinated and unmyelinated nerves. In the unmyelinated nerve, conduction is electrotonic, whereas in the myelinated nerve, it is saltatory. Now let's look at electrotonic conduction in the unmyelinated nerve. Now you can see, and this is the cell membrane of the neuron, of the axon rather. Now you can see that this is a representation of resting membrane potential. The inside is negative and the outside is positive. Now you have applied a stimulus here. So there is a reversal of polarity, which means an action potential is generated here. So the moment there is a reversal of polarity, there is a difference in charge between this point and the adjacent point. And therefore current flows. So there is a current sink. So now this current sink acts as the stimulus for this portion, and this portion gets depolarized. And then this would act as the stimulus for the neighboring portion, and so on. So every point stimulates the neighboring point, and that is how the signal is conducted. So you can see how slow this process would be. That is why electrotonic conduction is very slow. On the other hand, if you look at saltatory conduction in a myelinated nerve, what is the difference? So this is the point where you have applied the stimulus, so it is depolarized, whereas the rest of the axon is still in resting membrane potential or the polarized state. Now, these are areas covered by myelin, and myelin acts as an insulator. Now, this point, which is depolarized, would try to stimulate the adjacent point, but the current cannot be conducted because there is insulation. And therefore, the current can only be conducted to the next node of Ranvier where there is no myelin, which is not insulated. So now this point would act as a stimulus for the next node of Ranvier. So this is now in resting membrane potential. Now this will start to depolarize. Now once this depolarizes, this can only stimulate the next node of Ranvier, and that depolarizes, and that is how the signal is transmitted. So here you could say that the signal is jumping, or the action potential is jumping from one node of Ranvier to the next. That is because myelin insulates this region in between. So because the current jumps, the conduction is much faster, and we call that as saltatory conduction. So what are the advantages of saltatory conduction? The action potential jumps from one node of Ranvier to the next, so the conduction is obviously much faster. And apart from that, there is also less utilization of energy. So this process is much more efficient than electrotonic conduction. Now, there are many factors which affect conductivity. We've already seen how diameter affects conductivity. It is the large diameter fibers which conduct the fastest. Now, of course, myelination is a very important factor. The myelinated nerve conducts much faster than the unmyelinated nerve. And likewise, in a myelinated nerve, the distance between the nodes of Ranvier influences the conductivity. So, more the internodal distance, longer is the jump of the action potential. Therefore, faster is the conduction. There are other factors such as temperature, pH, pressure, and hypoxia, which can also influence the conductivity. The summation is an important and interesting property. We will learn about this in much more detail in the context of synapses. Essentially, summation refers to things adding up. So often when there are many subthreshold stimuli, individually they cannot generate an action potential in the nerve. The nerve cannot respond, but they can add up to reach threshold and generate an action potential. That is how summation works. There are two types of summation: spatial summation and temporal summation. These will be discussed in detail when we discuss synapses. Now let's discuss the last property, that is accommodation. Now imagine you sit on a chair. You initially feel the pressure of the chair, but what happens after some time? You stop feeling the pressure of the chair. You become oblivious to it. So this is called accommodation. Your receptors and nerves have accommodated to the continuously applied stimulus. So whenever you continuously apply a stimulus, the neuron can demonstrate accommodation. How it does this is by raising its threshold so that it stops responding to the continuous stimulus. That is the end of this section. Thank you.